and she fought. And she fought so hard, and she fought for every breath that she took. And in the end, we couldn't save her. And in the end, she couldn't go home to her family. She couldn't go home to that baby who will never remember her mom.
Governor Brad Little announced earlier today that COVID-19 is currently the state's leading cause of death. He also announced extensions to the coronavirus restrictions as the virus is putting a heavy strain on the state's healthcare system.
Our own Ian Smay is in the newsroom tonight. He's got more on Governor Little's announcement today. Ian?
That's right, Whitney. Governor Brad Little announced today that Idaho will stay in stage 2 of his reopening plan for the time being. Idaho first rolled back to stage 2 on November 13th amid an ongoing surge in COVID-19 cases. While both Idaho and Washington are halting any forward progress in reopening different industries, Idaho's restrictions are definitely less restrictive. In Idaho, people can still go to bars, nightclubs, and restaurants for in-person service. They just need to be seated. People can also still meet for indoor social gatherings, although they're capped at 10 people. Little also said Idaho may have to move to a crisis standard of care in hospitals. This means that hospitals would have to ration resources to patients based on survivability. Little painted a grim picture of what this could mean.
Here is what it means to you and your loved ones if we reach that point. If your son or daughter gets in a car accident, a hospital bed may not be available for your child, or your child will have to receive care in a repurposed conference room.
Little also says that Idahoans have to do more to combat the virus, but he stopped short of requiring masks in public. Several reporters asked the governor about why he hasn't launched a statewide mask mandate. Despite the virus being the state's leading cause of death and hospitals nearing capacity, Little said multiple times he didn't want to create a mandate statewide. One reason he gave was the fact that state law leaves the decisions to counties and health districts.
That's state law. It actually has been for 100 years in Idaho. Originally it was the counties. In the last 50 years, it's been the health districts.
He was also asked about protests at county health districts that have issued local mask mandates.
I will re-emphasize over and over, I want compliance. It is absolutely abhorrent what people are doing to some of these, whether it be a school board, whether it be a health district, whether it be a county or a city.
Now, Little did go on to say that he feels people are more likely to comply with mask orders if they are issued locally instead of from the capital in Boise. But Little did say that he wasn't ruling out issuing a mask mandate if hospitals reach their tipping point and people continue to disobey local orders. Whitney, Tom?